Before Mary could leave her apartment every morning, she had to check the stove exactly 7 times. Not 6, not 8, 7. If she miscounted, her heart would race, her hands would tremble, and a quiet terror would rise in her chest, whispering, "If you don't do it right, something terrible will happen." This was Mary's ritual, a silent, unseen battle she fought daily. And it wasn't a quirk or a phase. It was Obsessive Compulsive Disorder, OCD. Today, we're going beyond the stereotypes, beyond the jokes about neat freaks and germaphobes. This is the real story of Obsessive Compulsive Disorder, through Mary's eyes, and the millions like her who are just trying to live with a brain that refuses to let go. Mary always knew her thoughts were different. As a child, she feared she'd accidentally hurt someone she loved. She would mentally review her actions over and over to make sure she hadn't caused harm. At first, it just seemed like anxiety. But by college, her thoughts had grown darker and more frequent. She began to wash her hands until her skin cracked. She avoided public spaces. She repeated words under her breath to undo bad thoughts. Obsessive compulsive disorder is not about liking things clean or tidy. It's actually a chronic mental health condition where a person experiences obsessions, those unwanted, intrusive thoughts, and compulsions, which are behaviors done to neutralize the distress caused by those thoughts. These compulsions aren't pleasurable. They're urgent, ritualistic responses to fears that just feel inescapable. Mary wasn't choosing this. Obsessive compulsive disorder had chosen her. Mary didn't tell anyone. She was afraid of being called crazy or irrational, so she masked it. But masking comes at a cost. She missed work meetings because she was stuck in her car, checking the door lock over and over. She lost sleep reviewing conversations from the day, terrified she'd said something offensive. People with obsessive compulsive disorder often suffer in silence, because unlike more visible illnesses, obsessive compulsive disorder hides behind closed doors, behind raw, bleeding hands, behind apologies for being late, behind exhaustion no one can see. The worst part? Many people don't even realize they have obsessive compulsive disorder until years, sometimes decades later. So, Mary finally reached out for help after a panic attack sent her to the emergency room. The doctor referred her to a mental health professional, and after several sessions and assessments, she received her diagnosis, obsessive compulsive disorder. She cried, but not from fear, from relief. There was a name for what she was experiencing, and that meant there might also be help. Mary started a treatment plan that included exposure and response prevention therapy, or ERP, which is like the gold standard for obsessive compulsive disorder treatment. Exposure and response prevention therapy gradually exposed her to the thoughts and situations she feared without letting her perform the compulsions. Slowly, her brain started to learn that the fears didn't come true. She also began medication, an SSRI that helped reduce the intensity of her obsessions. It wasn't instant, it wasn't easy. There were relapses, setbacks, days she wanted to give up. But over time, the rituals lost their power. The thoughts still came, but they no longer ruled her life. So, Mary started talking openly about her exposure and response prevention therapy. She joined support groups where others shared stories that, well, really mirrored hers. The isolation began to lift. She learned to track her triggers, set boundaries, and, celebrate small victories. Some days, simply leaving the apartment without a ritual was a win, and wins add up. Obsessive compulsive disorder doesn't just disappear. It requires ongoing care, just like any chronic illness. But with the right tools, people can and do live full, meaningful lives. Today, Mary works as a graphic designer. She still sees her therapist. She still has intrusive thoughts. But now, she has a voice louder than the obsessive compulsive disorder. What are the supports for living with obsessive compulsive disorder? If you or someone you know is struggling with obsessive compulsive disorder, here are some evidence-based steps and supports. First, seek professional help. Find a licensed therapist experienced in treating OCD, particularly with ERP therapy. You can find a therapist here. Next, learn and educate yourself. Understanding obsessive compulsive disorder is empowering. Visit iocdf.org and CAMH. Another way is to join peer support communities like OCD Action in the UK and globally, or Facebook OCD support groups. Next, create a support routine. Journaling, mindfulness, and setting manageable daily goals can help reduce overwhelm. Next is family education. Families can support recovery by learning not to accommodate compulsions and practicing patience. Obsessive compulsive disorder isn't just about cleanliness or order. It's about fear. A fear that latches on to what you love and just won't let go. But OCD doesn't get the final word. With support, with courage, and with treatment, people can reclaim their lives, like Mary. She still checks the stove sometimes, but now she knows the difference between safety and compulsion. And that has made all the difference. If this video gave you value for your time, be sure to give it a like, share with someone, and check out our other mental health education videos.